So we've talked to a lot of organizations that still have travelers. A lot of groups have done a great job driving down bill rates, saving dollars, working with their agency providers to save money from some of the high watermarks that we were at in the last couple of years. But as we continue to talk to healthcare systems, it's very apparent that tens or even hundreds of millions of dollars in premium labor spend are still out there. And while that's better than what we've seen in the past, there's still opportunity to save significant dollars. And in order to do that, we have to be able to recruit at a level that allows us to release those travelers and replace them with core staff members. And that typically doesn't happen overnight. It's typically not a one-to-one replacement. We really need to fill up those units to a point where hiring managers and leaders will feel comfortable releasing those resources. That's what we specialize in. We have specific travel reduction programs that will allow us to have a focused effort on those particular units where we have high concentration of travelers, allowing us to recruit externally and get people from the outside to increase the core staff members, work on converting current travelers to core staff members. But at the end of the day, a couple travelers can save millions of dollars if we release them as compared to core staff members. So if you think that's of interest to you and would want to learn more, we'd be happy to discuss and chat about your specific situation. Feel free to reach out.